I am really pleased to welcome our members, particularly those members from Belize, St. Vincent and the Grenadines, Trinidad and Tobago, Jamaica, Barbados, of course, Anguilla, Trinidad and Tobago, did I say that already? And others who will join us as we move along. I want to say a very special welcome to Tele Islas out of San Andres, Colombia. They are also with us today. So we are happy to have quite a range of our member stations listening with us to us today. This webinar we are actually fulfilling a promise which we made. We had a previous one on February the 12th, and we did say that we would have a follow-up. So today we are looking at the current status and the future trends. So I am going to hand you over to Joel Ford, Caribbean Broadcasting Corporation, Barbados. Thank you.
Thank you very much, Hilda. A pleasure to be here this evening as we look at the current status and future trends of COVID-19. My guest, Dr. Itades Gerbe, he is representing the Barbados and Eastern Caribbean countries of PAHO. Dr. Joyce St. John, Executive Director of CARPHA, the Caribbean Public Health Agency. And joining us shortly will be Mr. Ronald Jackson, who's the Executive Director of CDEMA. Welcome, everyone.
Thank you.
Thank you for having us.
Let me start with you, Dr. Ibre. What is the status of the disease in the region?
Thank you very much. As you know, we are still experiencing an outbreak which is characterized as a pandemic. Overall, in the Americas region, we have over 500,000, close to 500,000 cases of COVID reported from 54 countries and territories. In this regard, also the Caribbean is not exempt from the Caribbean region, both from the north to south and east and west. We have over 4,500 cases being reported. The current trend in all of these countries shows that they are a mixed outbreak, meaning that we characterize the outbreak as sporadic, cluster, and then community transmission. In our case, in the Caribbean, what we see, or Eastern Caribbean countries included, what we see is a cluster of cases. And then in a few countries, it was sporadic. In the last 24 hours, 48 hours, some countries have progressed to be having a cluster of cases. This cluster of cases are cases which have appeared from a case, especially a traveling person who may have been traveling or coming from areas highly affected, and then ongoing transmission. So what we could say is that globally, we have over 1.4 million cases. The mortality is also, the death also is over 81,000 or 81,600 to be exact. Again, taking you back to the Americas, most of the cases in the last 48 hours have been reported from United States, Brazil, and Canada. So this is what the trend looks like currently. Back to you.
Thank you. Dr. St. John, is the virus evolving? When it first started, we were told to look out for flu symptoms, headaches, dry cough, shortness of breath. But it seems as you listen to more and more people speaking about their experiences, we're now getting body pain. Some people are talking about hallucinations, fatigue, body aches, diarrhea in some cases. Is it evolving?
I'm not sure if it's evolving. I don't think that we have any research that there has been any change from China. I'm not sure, Itades, I don't know if you could tell me if there has been any characterization of the virus to see what is the source, if it is China, if it is European, or if it is from USA. But in any case, what you are describing is the range of ways in which COVID-19 presents. You know that about 80% of all cases will be mild or almost undetectable. So the cough, the respiratory symptoms, that's how most people will characterize it or will describe it. But we do have 20% that will be hospitalized. 15% will be hospitalized, but they'll go home. And 5% will go into intensive care. And at that stage, you get a change as well, not just that range of symptoms that you've described, but also reports have been coming to us that it is at that stage that you get the pneumonia. So I can remember at one stage I was saying, people don't understand this is like a transmissible pneumonia. But we have also seen other signs because of how it affects other organs. For example, there is heart failure. There has also been the description of eye signs. So I've actually seen literature where ophthalmologists, but most people who would examine the mucous membranes, eyes, nose, mouth, they're not doing that kind of close examination anymore because the viral load is very high. But you can also have signs in the eyes even before a person is aware that they have an illness, which indicates that COVID-19 has affected that organ. So it is not evolving. What is happening is that we're learning how it presents. COVID-19 has not been around for very long in the world. And the way in which COVID-19 affects our population in the Caribbean is going to be extremely important because the risk factors and the presence of non-communicable diseases have been shown in all of the regions to be the harbingers of a person having the very severe forms of the disease, requiring hospitalization.
We are seeing it now being reported in the United States, especially, that their African-American population are the ones now who are they're presenting with the disease, and they are the higher percentage of deaths of the disease. So here in the Caribbean, is that something we should anticipate?
Who would you like to answer that first? Because both of us should have a stab at it. Go on, Itadis, you start first, and then I will follow.
Thank you very much. That's a very important question. First of all, the Dr. St. John mentioned clinical presentation and also who may be affected disproportionately when it comes to the severity and complications. Let's go back to the 40, 15, and 5%. What we have learned is that 40% of the cases are mild, the other 40% are moderate, and then the other 15% are severe, and then the last 5% are critical. So those individuals who may have critical illness and those who may have also severe illness disproportionately are individuals with chronic diseases. In addition to this, some of those individuals who had moderate infection, over time, about 20% of them could also pass to be severe illness. All this will be depending how the immune system of the individual also try to cope with the infection and then fight the infection. On the other hand, what we are looking at, the chronic diseases like diabetes, hypertension, or any other immune suppression diseases, including cancer, individuals do have higher risk of severe illness. Therefore, what we learned in the United States, especially the African American population.
Excuse me, Dr. Ibre, if you are not speaking, please mute your mic. We're getting some feedback. We're getting reports of feedback. So if you're not speaking, please mute your mic until you're ready to speak. Thank you, Dr. Ibre. Go ahead.
Thank you very much. I was speaking. The point I was making is that the African American disproportionately affected in the United States, being said that primarily due to the chronic disease, higher prevalence and incidence in this population. That also put them, since an infection which is affecting the lungs and the chronic lung infection or any other may also result in this infection. So going back to the Caribbean, definitely we have high incidence of non-communicable diseases, hypertension, diabetes, of that nature, and respiratory illnesses. Therefore, we may anticipate from those. I think in the Caribbean, we have over 4,000 cases reported over the last 8 weeks period. And then of that, 194 deaths, which is comparable in other area for case fatality, disaggregated by age, even for data provided by countries like Barbados and other countries. Still, individuals with older age do have, and then with chronic disease do have higher mortality. The number of cases or deaths would be higher compared to other places. Therefore, yes, we may be looking more for individuals with chronic diseases to be affected severely. Thank you.
Dr. St. John.
Let me take a stab at it.
No, you're going to take a stab at it.
Yeah, so I cannot presume to know what is happening in the US, so I'm going to regurgitate what the US authorities have been saying about this disproportionate level of illness. And I'm not sure if I heard about death, but the level of illness. And what they have been saying is that this is perhaps a function of some inequities in the provision of health care, as well as the fact that, just like their Caribbean brothers and sisters, they have issues with chronic diseases as well. So let us just park that there. Your question was if it is going to be something that we see here in the Caribbean. And what we have been seeing in the Caribbean so far, because I think in terms of the epidemic curve, we have not yet started to go into that steep part. We're coming out gently of the almost flat part, and we're going into the rise, but not in the exponential part as yet. So what we are seeing so far is more the distribution of the persons who have those risk factors for more severe disease, the older persons. If you look at the deaths, if you look at the description of deaths across the region, it's usually the very older persons with underlying conditions, those NCDs, etc. I have not yet seen if we're also experiencing that men have a more disproportionate risk of illness. I have not yet seen that because I don't have those I don't have that breakdown. Unfortunately, the countries are not reporting to us so that I could do that analysis. But the other thing that we have noted, and this is something that we're going to put in an upcoming situation report, because we do a situation report every other day. What we have noticed for those who were connected to travel was that a lot of the early cases were coming from a particular region or regions. And it was also pointing to a particular geographical area within that region. So we have found that to be of great interest in the analysis of what was first mainly persons with travel history. As the case definition has evolved, and we're seeing more persons who are not connected to travel directly or interacting with someone who travel, we are seeing some rather interesting things about their make up for the ones that are reported to us. And it's mirroring those risk factors again. But we are also getting a few that are a bit of a surprise. Like, it was a bit of a surprise to hear about a baby, and it was a bit of a surprise to hear about a child. So it's going to be very important for us to really plot that epidemic curve with the reported cases and do a proper analysis of the risk factors. And then we will be able to say, what is this issue? Is it a Black person issue, or is it another issue? Luckily, in the Caribbean, although we're supposed to have weak systems, the public health response has allowed us to see what a response with good health services can do in terms of if a person is picked up, if a person is followed in the services, like Itadi said, picking them up quickly, ensuring if they have deterioration that they're properly managed, and if they do deteriorate further and need intensive care, that they receive it. Long may it remain so, because the issue with COVID is that it comes in like a thief in the night. You don't know who it's interacting with, and all of a sudden you get an explosion. So far, we are not yet in the explosion phase, but as a region, the Caribbean is preparing for that.
How critical is testing in terms of being able to track who has the disease, whether it was mildly or severely? Testing seems to be a constant issue or debate. Some places that have tested as many people as possible seem to be able to track the numbers better. Some people have tested less persons, so therefore their numbers are artificial because they haven't tested enough. There seems to be no set amount of testing. So there's no, let's test 1 in every 1,000. The testing just seems to be random. If you show the symptoms, you get tested. If you don't show the symptoms, then. So let's talk about testing.
I want to say something first because of something you said. Testing is definitely not random in the Caribbean. In the Caribbean, and Itadis can expand on that, because I really want Itadis to talk about this testing because of what the Director General said. But in the Caribbean, the testing has been guided by sound public health principles, following the case definition, contact tracing of those who are found to be positive, and extending the rings of contacts where that is concerned, and then being guided by those rings of importance of testing to follow where there are geographical, as Itali said, clusters, or so the testing is not random. What people have been talking about is this whole issue of asymptomatics, but we are not going to get there until we have a case definition. But I'll stop here and let you Itadis go on.
Okay. Dr. Ibrahim?
Yes, thank you. It's very important to have testing done to control this, to contain this outbreak pandemic. One of the strategies WHO, PAHO, including CARFA, advocate is that we have to test. Once we test, we have to isolate. Once we have a contact, we have to do the test, and based on the case definition. Case definitions are very important at this point in time as well. We are in the early stages in the Caribbean. By the way, when we talk about Caribbean, we have also to include the Latin Caribbean from the Dominican Republic, Cuba, and others do have also more cases, and we are also learning more from them as well. So going back to the testing, when we look at the proper way of handling this outbreak, despite the lack of resources to have a vast testing capacity in many settings, to know if somebody is infected, and then to know the contact is also exposed, and to know what will be the next service availability. Once we test the person with the symptoms, the next level would be to manage the person. So unless we do those kind of things, what kind of treatment to be given will not be reaching there. Therefore, testing is very important. We have to test, we have to isolate, we have to track, and then we have to quarantine. So with that process, we should be able to actually contain the outbreak. So as you said, testing is a very critical area. Countries to expand down the road when we have explosion of cases, exponential increase of cases. Are we anticipating of exponential increase of cases? Those are the things also we have to look at. It's based on our capacity for testing. Otherwise, we will not be able to know and then track the outbreak at this point in time. Thank you.
Let's keep talking about testing. I was doing some reading where persons who tested negative in China are now retesting positive again. So how reliable is the test? Are we seeing false negatives in terms of the testing results?
In the Caribbean, what we have done is to, and the we is CARFA and PAHO, because CARFA is testing for 18 of its member states. PAHO has given the ability to test, and that is not just provision of equipment and reagent, but also training and ensuring that the structural makeup is the correct one, because you do need different functions for different, and different rooms for different functions. What we have done is we have relied on polymerase chain reaction testing, which is as close to gold standard as possible, because it is important to have accuracy in these early phases. What may have been happening, and I know is probably happening in other territories within the Caribbean, is that some people may have started using antibody rapid tests. Now, these rapid tests are not as accurate as the PCR.
Dr. St. John, let me interrupt you there. Are these tests that are supposed to take 15 minutes rather than I think the ones we're using now that take 4 hours for the results to come back?
Well, you need to be careful about the time that you say that it takes.
Okay.
The rapid tests are taking shorter times, but you do have some PCR rapid tests, not in the Caribbean, but they are available elsewhere that take 45 minutes. So you need to be careful. It is very much method specific. But those ones, some are point of care, some are what you would call the home kit. They do not have the specificity because there are a lot of coronaviruses. The common cold is a coronavirus. So there's cross-reactivity with the other viruses that are in the Caribbean space, and they are not sensitive. So that's when you get the false positive, and they're not sensitive. So you get the false negative, which may have been what happened in China. So you get the false negative because it just isn't picking up what is there. To me, the false negative is almost like a license to spread. So for me, the false negative is quite worrisome in these early times.
At this time, as far as we're aware, once you've had it, that's it. You can't, can you still get it a second time, or at the moment, you, as far as we're aware, you cannot?
May I add to what?
Yes, Dr. Ibrahim.
Yeah, thank you very much. And then I will ask Dr. St. John to continue on the second question. Your first question is a very important question. We have heard again and again that kind of stories where individual, after completing treatment and then released, and then the second time they've been tested positive or something like that. So the current guidelines we have, individuals to be released from treatment is that once they have completed 14 days of isolation and then have at least 2 negative tests within 24 hours. So that's in 24 hours apart. So that's what it is we are using. So individuals, once they have completed that test and they're negative, then they will not be danger in terms of source of infection for others. That's what we are trying to avoid. Why we hear again and again that people have been tested twice after a certain period of time, they have tested positive again. One, I think Dr. St. John mentioned also in this regard, what is the testing mechanism? Two, individuals, the laboratory itself, are they using sterile work environment so that there will be any contamination? So it will be from the laboratory. It could be from the test. What kind of test being used? Could it be a false positive being given? So in each state, case by case, we have to evaluate. Otherwise, some people would consider that, and if the person comes positive, if there is a reinfection, what we can say with current knowledge is that individuals who once infected, the immunology is that persons will build antibodies, meaning that the infection have triggered the body mechanism to fight the virus, and then there will be some antibodies in the body so that when there is a second infection, it will fight it off. So that's what the principle of vaccines are. So if individuals are not able to fight it after infection, we will not be doing anything in vaccines. Viruses, especially like coronaviruses, are particles. They don't have anything else other than to enter the human body and then multiply. Therefore, the assumption that they would have been second time or third time positive after being negative could be wrong assumption. Back to you.
Dr. St. John?
Okay, so Italis has done a really good job, but I think what you're thinking about and what some viewers may be thinking about is this whole issue of, has COVID mutated into strains? And there have been discussions about 40 strains and 8 strains, but viruses mutate, but does it get established as another strain? Is it going to end up in a situation like dengue? And we don't know yet. We aren't going to have those answers. But the rule of thumb, because we have an expert advisory group drawn from practicing doctors in the Caribbean. And the virologist has told us that it is very unlikely that we are going to have that kind of thing develop. But none of us is God. We need to watch it and characterize what is going on. But it really seems to me as if when you get these sorts of reports, it's either the method you're using and its sensitivity and specificity, or as Itali said, you might get some contamination in a lab. That's why the quality control that PAHO did in the establishment of testing capacity in the Caribbean was very important, because you cut down on these contamination things. And I need to say that in terms of capacity to test in the Caribbean space, we have some of the best capacity that the Caribbean has ever had in terms of the countries that can test. And we know they are testing with proper methods and techniques, et cetera, et cetera.
Okay. Dr. Ibre, I want to go back to something you talked about people building immunity, and there are several studies and remarks being made about this whole thing about herd immunity. That was the method that Great Britain was using, and it was laughed at. But I've been reading somewhere else where someone is saying the only way you can build an immunity to the disease is if you're exposed to it. But if we're all home locked down and you can't build that immunity because you're not being exposed, then when we all come back out and communities open back up, then you're going to get a second wave of the disease. Your thoughts?
Thank you so much. This is really another excellent question when it comes to so-called herd immunity and what is the exit strategy? That's what the question is all about. Are we going to continue to keep social distancing and then physical distancing and then expect that we're going to ride the outbreak, or do we have until vaccines are available, or do we have any other ways of coming out and then be normal, maybe prior to COVID outbreak? Yes, the situation is that herd immunity is that when we have susceptible individuals who could be easily affected, at risk of infection, have already been infected and then build antibodies. And then by a large population, when they have this kind of infection, they could be the barrier for infection of others. So meaning that if we reach 80% of the population infected and then have developed antibodies, then the other 20% would be protected by the immunity of the other 80%. So that is what a herd immunity. So are we advising now, let's go out and then get infected as many as people so that we can build the immunity and then go back to normal life? That would be a very naive way of addressing an outbreak of disease, of a new disease like coronavirus, COVID-19. So the best approach would be to reduce to reduce transmission. To follow up the measures, the preventive measures which authorities are saying. That wash hands, cover your cough, and then keep distance. Those kind of things will continue to reduce the transmission. And individuals, once they've been infected, have to be tested and then isolated, and then their contacts and then susceptible for individuals also to stay away. So we have to continue to identify who are the most vulnerable in our society. We know from the studies in China, Italy, other places, what is the trend of this infection? Who do have higher risk of infection, severity of infection? It is currently older adults, and then people with comorbidities like illnesses, which I mentioned, chronic diseases, diabetes, hypertension, of that nature. Therefore, we have to protect those individuals. We cannot just go on with assumption of herd immunity would protect us. Otherwise, we're going to lose as many as 15-20% of the population who may have been infected because they would have higher complications and outcomes.
I just received a message that the acting Prime Minister of Barbados, the Honorable Cynthia Bradshaw, will be issuing a statement live at 3 p.m. So we may have to break into the program. I want to welcome Mr. Ronald Jackson, who's the Executive Director of CBU. Good afternoon, Mr. Jackson.
While Mr. Jackson is settling himself, I want to say...
Hi, good afternoon. Good afternoon.
Hi, good afternoon.
And to my colleagues online.
Hi, Ron.
John Daniel says, hi, how are you doing?
I'm good. How are you? I thought
I am fine. You thought what?
I thought you weren't coming, Ronald.
Managing multiple things.
Okay, you were saying, Dr. St. John.
Yes, I wanted to say that this whole issue of protecting people isn't just about vulnerable groups. It's going to be important because the world has changed so dramatically. It's going to be important that we also seek to protect the persons who know how to make things work, the persons who govern us, the persons who know how to rebuild the security, the teachers, because we still have a situation with young people who have to learn. So we have to also take a perspective of those who are valuable for ensuring that we can build back our lives after we come out of this. And I wanted to say that this whole issue of how we get out of the curve is what's hurting my head right now. I would really like that we approach this from the perspective of of Caribbean unity. And we have a unified way of approaching the science and also the political and economic realities, because a lockdown means no cash flow. So how do we deal with this?
That's a good question. That leads me, allows me to segue nicely to Mr. Jackson. Mr. Jackson, we've seen this lockdown implemented in varying ways across the region. Some people, it's been a total lockdown. Some, it's been a partial lockdown. There've been curfews where you're still allowed to go out and get bread. Your thoughts in terms of the management of people and social distancing?
Well, I think the fact that all the governments applied some policy measure to try to flatten the curve is something that we commend. And I think all of us in the response and coordination community would have championed. There is always going to be questions as to the timing of it or how advanced these measures may have been. And I think as we go, we see where member states are themselves evaluating the decisions and making sure that the requisite constituents within the countries are able to cope with the environment that is produced when you have to go into certainly a very hard lockdown consistent with the 24-hour sort of curfew arrangements. And here now I'm talking specifically of the social impact for those individuals who live daily based on the income streams that they receive, or even weekly, and may not have the level of savings that allow them to prepare adequately for the long haul of what is currently going on and what may be to come as governments continue to adjust their policies to keep within that idea of a flattened curve. And so that's where we are concerned. We're concerned with whether the national apparatus is leveraging the entire emergency management infrastructure to be able to address some of these issues that are going to arise when these measures are applied. And they're the right measures. But what we need to do is to make sure that we're taking consideration of these individuals who live daily. And where I come from, we say hand to mouth on a daily basis. We have the humanitarian and relief arm of national emergency management agencies that can be mobilized to be able to provide and set up, the type of relief hubs, so people who may not have the requisite resources can access these types of support. There are new creative things being done in that space as well, in terms of the provision of cash linked to national social protection mechanisms. And we see where some countries are beginning to apply those measures, but it's something we would want to be considered across the board and very comprehensively in the plans that are being rolled out for the lockdown.
As a people, we don't know how to do this. We don't know how to stay in a house all day. We don't understand not going by friends and linemen, especially Caribbean people. This is hard. And as we see the lockdowns and dates are set, and then obviously those dates will be extended because we've either now really rapidly starting to climb the curve, etc. Is there a plan in place that will deal with what we are already seeing, which is the rise in domestic violence, the rise in sexual abuse among minors, et cetera, et cetera? We're seeing more of this. And especially when people can't go out to church, there's a community you feel when you are at church with with the rest of the congregation that you don't feel when it's just you and your iPad home alone.
Yeah. I don't know. Again,
Mr. Jackson, do you have your camera on? We'd like to see you.
I've been under lockdown for a couple of weeks. I don't know if I'm camera ready, but I will definitely share my image in the interim.
There you go.
Again, here we have to fall back on some of the measures that we have in place and that we've been applying in other circumstances. So there are parts of our apparatus that looks at these gender-related issues that look at the social implications of these adverse events, these adverse hazard events. And here COVID-19 is the hazard we're grappling with. And these must be brought into the picture. At the regional level, CDEMA is working with its regional intergovernmental organizations and the CARICOM Secretariat to articulate a broader regional protocol that is looking at all of these issues in its totality, in terms of where we expect the implications for COVID to be beyond simply health, and what sort of value-added support can be brought to bear from the different sectors in addressing some of these problems. It's the same approach we're commending to our member states to really activate the systems. Obviously, yes, we know we're having to operate on these matters in a virtual space, but it doesn't mean we can't be creative, as we have been, in thinking through how we can apply these measures in terms of the necessary surveillance. There are locations we're aware of in terms of the various gender bureaus, the police, and others who may know of as hotspots, where they can then zero in and treat with some of these issues. The access to counseling, the access to support systems for not just women, but also the men who are perpetrators of the gender-based violence. Outlets for them to be able to really speak to the challenges they're facing in this time, especially where there are lost income streams and there's an expectation within the family to support survivors. So these are certainly things that are on the minds of the key leaders around the table regionally. It is on the minds of many of our partners who we are currently collaborating with. We are having a very well-evolved collaboration with the UN system. You see Dr. Yetades online. He's working very closely with Dr. St. John and ourselves. There are other members of the UN community who are working close with us, and we're trying to make sure there's some alignment in what we're doing. And this is a conversation that is happening. We want to now move this into the national planning apparatus so they can roll out these comprehensive approaches. And leverage, as I said before, leverage the emergency management system was built with some of these things. We need to leverage them, wake them up and put them to work in support of the health response.
Mr. Jackson, in the few minutes we have left, I want to invite the other persons who are watching to pose some questions. Please give your name and the organization that you represent.
I just want to say quickly that I am also working with this lockdown, and the church has been broadcast via TV for some time now. Our local churches have got really creative, and I've been going to church via TV for a long time in the different countries that I've lived. And since this lockdown, I have been doing exercises with my daughter and her friends. One person leads us in the exercises, and where we are all over our locations, we do the exercises. I'm still stiff, but I mean, the point is we can find ways to do a lot of things still. I don't cook, but my girls have been cooking up a storm. Some people are cooking. So
I've started about baking, so yeah, I know what you mean.
Right, there are ways of channeling our energies, but this whole issue of abuse, because people are in close quarters, this is something that we've been turning to, for example, UNICEF and so on, for guidance on things that are happening from the health lens, the health perspective.
Yeah, may I add on this? The social distancing, physical distancing in general, the curfews and lockdown are important measures, public health measures, if they are added to the other ways of interventions. That's the most important part of it. As you know, currently, especially in the English-speaking Caribbean and others, we have not picked anywhere the outbreak. So are we waiting to move up there? Or we can also stifle it before it reaches there. So the moment we started to test and then isolate and quarantine, by doing all those things, including the social distancing, we should be able to contain the outbreak. That's one thing. We don't have to have everybody to be infected in order to have a better outcome. So that's one thing we have to look at. On the other hand, for the domestic violence and related issues, when people are social distancing and other things, yes, it is a real problem. Mental health is a real problem. Also, for additionally, we have to address them. We are working with the different stakeholders in the UN, UNFPA, UN Women, and others to address this issue. Thank you.
Okay, I may invite some questions now from the journalists and others who have joined us from across the region. Please state your name and the organization that you are representing. Hello.
Hello, good afternoon.
Good afternoon.
Right, Paul Clark from the Gleaner, Jamaica.
Mm-hmm.
Right, Miss St. John, you mentioned not too long ago coming out of the curve. Question to you, as we see Wuhan, China is now awakening. That's the reports we are getting. I'm not sure if that's true, but that's what we're getting. The question is to you, what do you envision us, the Caribbean, what it will entail us coming out of the curve? What does that mean really for us?
Okay, well, first there's a plotting of that epidemic curve. So we're going to look to see the rise in numbers, a peaking, and then a diminution in numbers until we get to the phase where we're not having any new cases or not having any new deaths. And we would have to go through a 4-year period where we don't have cases or deaths. But apart from that, I really would like, if it is possible, and I don't know if Itadis can weigh in here, I would really like if we could find some way of ensuring that we knew the immune status, if not of everyone, but some proxy way of determining it. And these sorts of discussions have been held for the last week or two among my circles in public health. Can we characterize by antibody what is actually going on? Because remember, right now we are doing measures to protect those who are vulnerable. So those who have not been exposed are not the strongest. The strongest are the survivors. And so we really need to make sure that we are protecting them. So having an idea of the immune status of the Caribbean would be part of the science behind it. I don't know if we can actually do it, because the other thing about COVID is that COVID moves so fast. To get all that kind of research, even though we are small communities in the Caribbean, may not be possible. The other thing about coming out of the curve, in the same way that the public health measures have been enhanced by the national measures, the closures of schools, the stopping, congregating, the lockdowns, that is also going to have to come into train. What are the national measures that go along with coming out of the curve? Are we going to be looking for where disease is rampant and screening those persons before they come into our region? Are we going to be having conversations, continued conversations with the cruise industry and the airline industry for their measures? So this sort of discussion is definitely a multi-sectoral, coordinated discussion about coming out of the curve. So it's going to look a particular way in terms of the public health measures. I hope it will look a particular way in terms of the political and containment measures. And I hope that there would be discussion with key partners in the business community and in the tourism community and other communities. I need to say that I have a 3:30 meeting, so I probably will leave when you all break to listen to the acting Prime Minister. And I just want to wish everyone the best and to stay healthy and happy Good Friday.
Thank you very much, Dr. St. John. Any other questions from any of the other journalists and partners across the region?
Yes, I'm Carol Francis from PBCJ, Jamaica. We wanted to just ask two quick questions. One, this whole issue of testing, is it that the numbers that we're seeing, is that the correct number? Because are we doing random testing or are we just testing for persons who show signs of having the virus? That is one. And number two, there's a whole discussion going on about the BCG vaccines in the Caribbean. Is that something that you're looking into?
Dr. Ibrahim, I'm going to start and let you take that one.
Yeah, thank you very much. I think that's also a wonderful question. First of all, what we encourage all member states or countries is to test only individuals with symptoms. So suggestive symptoms or severe acute respiratory illness. That is individuals with high fever, cough, sneezing, and then muscle aches, those kind of, and then shortness of breath, and then difficulty in breathing. Those are the indication for testing. We don't suggest individuals to be tested because they are a contact of such a person, but those individuals to be actually quarantined and then wait for the next few days if they are developing symptoms. So the answer is that it's only by symptoms individuals, not everybody, or randomly tested, only with individuals with symptoms. The second question about BCG and protectiveness. There would be some articles written, actually a paper published recently, that countries where they have BCG, or this is vaccination for children to protect from tuberculosis. So those individuals who have been given BCG in the countries, it is actually a correlation. The countries where they have BCG vaccination have lower infection rate. So that's kind of relationship. And then, is it a protective factor? It's not a protective factor. So we encourage researchers to do more analysis in our region. Thank you.
Okay, thank you, Dr. Ibrahim. Anyone else? We have just another few minutes left. While we wait, go ahead.
Okay, I was saying, since no one else is asking, another issue that has seemed to come to the fore is that I noticed that there was an article from the Cayman Islands, and I don't know if that is a situation that has happened to other countries across the Caribbean, with the whole issue of purchasing of much needed equipment and it being blocked from entering the Caribbean. And I wanted to know if that is something that is affecting the region in general, and what it is that can be done if that is the case.
Mr. Jackson?
Well, we I don't know how widespread the problem is, but we have seen at least 2 cases reported where items procured have had challenges leaving the ports from the United States. We have been doing bulk procurement on behalf of some of the member states. We have, on one hand, we have been working with a purchaser who was engaged by one of our global partners to try and ensure that we can get a better foothold in the market, both in terms of price and availability or access. That is in its early stages, and we're hoping we won't face those challenges ourselves. We're looking at different source areas for the items to ensure that we don't have the problems that we see emerging both on the Cayman case and the other case we have seen. We do recognize that within the region there are shortages. We have one funding partner was indicated to us to try to procure some of the items we are sourcing within the Caribbean based on the challenges that are being expressed nearer to the region. And even there, we're seeing shortages, and we're seeing that some of the items are delayed coming out of that particular port. So it's something that is emerging. I can't say I have a full handle on whether this is going to be a consistent challenge. But what we're doing certainly is working with other larger purchasing partners to try and ensure that we can ourselves navigate some of these challenges.
Thank you very much, Mr. Jackson. This is where we're going to have to wrap it up, unfortunately. Dr. Itadis Gerbe, Dr. Joy St. John, and Mr. Ronald Jackson, thank you so much for participating. I'm going to hand back over to Hilda Cox-Berlin of the CBU. Hilda?
You're welcome.
Thank you. Thank you very much, Joel. We must thank you a whole lot for doing a great job, as always. On behalf of the president of the Caribbean Broadcasting Union, as well as the board of directors, we want to thank you, the panelists, as well, for joining us once again. And we really appreciate your continued commitment in this crisis, which we are experiencing right now. I also want to say that we are in the process of discussions with the hotel sector because we are looking at the possibility of another webinar where we would focus on the effect of COVID-19 on tourism and our economy in general. So once again, thanks also to the members of the union because without you, there is no program, of course, and we want to thank you all. Thank you very, very much.
Thank you.
Join us again another time.
Have a
Stay
happy
safe, everybody.
Holy Easter. And as Joy said, exercise, enjoy nature. Nature is breathing for a bit, even as we go through these challenging times. Nature is perhaps the winner.
Yeah, but
yes, indeed.
Thank you very much.
Socially distance when you go out.
Agreed. Thanks, everybody. Stay safe.
Thank you.
Bye-bye.
Bye-bye.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
The corrupt are getting away too often. Help catch them